We sent our production crew around the world to collect stories from the patients who received the exclusive patented Bonati Spine Procedures. Today, we'll highlight a patient from upstate New York who was referred by his chiropractic doctor, Joel Santy. We'll find out why he referred this patient to Dr. Bonati, as well as hearing from the medical staff who assist in treating them at the Bonati Spine Institute.
Okay, my name is Sandy Billington. I had some numbness in my back, and I had some pain that would radiate down both of my legs and would prevent me from walking maybe 50 feet, and then I would have to sit down. Quite bothersome, actually. At times I was unable to do my job. I work as a nurse. Well, in nursing we always have a pain scale of 1 to 10. And many days I guess I'd have to have rated it as a 15 to 20. It was hard to sometimes take care of the patients, just to get from the beginning of the hallway down the hall to their room. I would stop in the hallway and I would actually bend over and kind of like pretend I was tying my shoes, because then I would be opening up the vertebrae and releasing the pressure. And then I would stand up and continue on down the hall. I have a very supportive husband. He was always there to, and always is there, to help me in the different difficulties that I would have.
She wasn't feeling very well. She was kind of down and out. She felt pretty bad because she couldn't put in a full day's work or work what she did before. We couldn't kayak anymore, and we couldn't bicycle. We did a little bit of bicycling, but
Right.
It bothered her back a lot, so we had to limit what we did.
Walking was difficult. He was always very understanding if all of a sudden I had to stop, doing something. He was good about it. He would take over. He did the vacuuming for me because it was always hurting, bending and stretching a lot, like in the bathtub. He would take care of those issues for me. Standing on my feet too long really became, hurtful. And he was good about, cooking. And so life changed. I did physical therapy, and I was on some pain medicine, but not very strong, because I really don't like to do that. And trying, better posture and just doing what I could do, more of a holistic type of an approach. And then I decided that it just wasn't working, so I went to this doctor in Vermont. I had the MRIs done, and then I went back to see him, and the option was to have rods and screws and a big long incision down my back. And now I've taken care of a lot of patients that have had back surgeries, and I just thought, this is not an option for me. And I'm a realist, and I knew that something had to be done, but I walked out of there in tears, and I said to my husband, it's not happening, I'm not doing that. There's got to be a better way.
Up until I had Bonati at my disposal, I went with those traditional and conventional surgical procedures, the fusions that you've talked about, and I really was not seeing the success. Without knowing exact numbers, I would say I would have referred over 60 patients to the Bonati Institute since 2005, all with great success stories.
I sent them out this message that they asked that you send this information, which I did do. They got right back to me and said that they felt they could help me. I walked in, it was big, it was massive. The first thing that I noticed is all the glass on the outside. I thought, whoa. People were very friendly, very welcoming. It made me feel at first like it was not a sterile environment, but like it was, I don't know, a big open space. But there were people sitting here and talking and conversing, and it made me feel very welcomed anyway. They had a nice little bar where you can have, your coffee and all of that for the family members that are waiting for surgery, and that was very nice. Paul was there. He greeted us, and he was very cordial, friendly, funny, witty. He was good. Everybody went seemingly to be above and beyond. From a nursing perspective, I look for that because I think it's very important to make a patient feel comfortable. And I feel that these people did go above and beyond to make me feel that way. I actually had 2 procedures done by him. I had one done, and that day actually in the recovery room when it was over, the nurse, I told her I needed to get up and move, and she asked me if I wanted to use the bathroom, and I said, can I walk? And she said, do you think you can? And I said, I guess so. So I got up, and instantly I didn't have any pain. And I was like, wow, this is a miracle. And so I did. I went and used the bathroom, came back, and within, I don't know, an hour after recovery, I walked out of there. And I thought, this is just wonderful.
It's a tremendous technique, and it works so well. And the patients get up, there's so little recovery time, they are happy, they are pain-free. That's the key, and they get their lives back.
We walked out that night, we were walking around the parking lot, which if she'd had rods and screws and nuts and bolts, she would have never been able to do that. Would have been recovering for a lot of months. But this way here, we got back in the airplane and flew home. So it's just like, it was a miracle. It was something that I never expected.
I was pretty much awake, but not totally. I was in and out of consciousness. I watched it a little bit because I wanted to. And then I'd say, oh, I don't want to see that. But I wasn't totally out of it. I did respond when they asked me something. I did feel a few things. It wasn't an unbearable, uncomfortable thing. I was surprised that they could do what they did with me in that state of mind, but that's what conscious sedation is about. So I think it was been a great thing for me. I function, I kayak, I bike, I walk, I hike, I do lots of things. I still can do some nursing. I don't do the patient care that I once did because, you know, it's tough lifting some of these patients. So I do more of a teaching on a maternity floor, and I work in an office locally that does cataract surgeries. So I feel good.
People don't come here to be patted on the head or to be given medicine. People come here because they have pain which is truly affecting the quality of their life. Being able to have a positive impact on that pain is very rewarding.
I'm very blessed to be able to still work. I love my job. I love nursing. I love all the aspects of it. I've been put into a wonderful field. I believe that Bonati Spine Institute really was beneficial to me. I think they can help a lot of people. I have recommended the Bonati Spine Institute to many people. They've seen the progression that it has given me, and they've seen all the help that I've had because of them. And I would strongly recommend they at least give them a call or send an email via their website just to find out. You don't know what's out there until you try it. I believe they've been given a gift of non-invasive procedures that they can do. They've perfected them. I've had very good results, and I would highly recommend them.
Every time that I walk in the operating room, when I am scrubbing my hands, I always thank God for the opportunity to do this. And it's very unique, that feeling. And you need to appreciate it. The same like the patient. When you are doing this surgery, the patient appreciates that. And it's amazing how easy the word God comes in their minds.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
I can honestly say that I just had my last surgery 4 days ago. I feel like a brand new man. The next morning that I woke up after my first surgery at Bonati Spine Institute, I felt immediate relief in my legs and in my feet. And I couldn't have been happier.